Back pain has become a global problem. It has become the leading cause of global disability in the world. And in the United States, there's probably over 200 types of providers that actually treat back pain. We take a stepladder approach, and when I say stepladder approach, I'm referring to starting at the bottom of the stepladder or the pyramid with the least invasive, most comprehensive, and most conservative care first. So our goal is to get patients under care within 72 hours from the time that they call us. Where they start care is very important because it helps to achieve the best clinical outcomes if they're starting with the right specialist at the right time. We pick the most appropriate specialist for that particular person's pain and problem.
So when a patient comes to the Back and Neck Pain Center for the first time, we ask them to bring any records that they have, any prior imaging that they may have had in the past, and we'll bring them here into the office. They'll be checked in at the front desk, and they'll come into the office with me. Now, when we come in, we'll go through a very thorough history, review any prior records that they may have, any patient may have, and we conduct a really thorough physical exam that's focused on your specific complaint, so whether that be back pain, neck pain, and the specific type of pain that you have. Now, the focus of our exam is to really identify the cause of that pain. Once we finish the exam, then I can go forward and we can recommend any kind of treatment, whether that be non-narcotic pain medication, any referrals to conservative care such as physical therapy or chiropractic care. I also typically order imaging as appropriate for the patient based on their complaint. That's something that we would review at a follow-up visit. So we would go over any of the imaging. I would show you the images right on the computer so we could review them and you could really see what's going on and what's causing your pain. From there, I do refer out to specialists as needed, whether that be interventional pain management or a spine surgeon. And then, at follow-up visits, we will reevaluate your plan of care on an ongoing basis. So to make sure that you're benefiting from the treatment that we're referring you for and that you continue to improve. And then we make adjustments as necessary.
We have an arrangement with specialists that they take care of our patients on a very timely basis. The reason that's important is because patients, when they try to do this on their own, sometimes they're told, we can see you in 6 to 8 weeks. By that time, a problem is worsening or becomes chronic and becomes very difficult to manage and very difficult to get a good clinical outcome. Not everybody gets better with conservative care. So in our stepladder, the spine surgeon is at the very top of the ladder. Classically, only 5% of the patients will need spine surgery.
Now, one advantage of the Back and Neck Pain Center is that we do have interdisciplinary meetings on a weekly basis where we all share our views and opinions, our medical opinions, and our treatment opinions on all of the patients who come into our office, so all of our shared patients. We meet together, a collection of providers, whether it be myself, a chiropractor, a physical therapist, a representative from pain management, and a spine surgeon, and we all review each case that comes through the door. So we make sure that we're getting opinions from various different specialties to make sure that we're always giving the best recommendations for care.
The Back and Neck Pain Center Mather Hospital is a program that is very comprehensive, and we integrate with multiple specialists to help our patients get better, decrease their pain, and equally important, improve their function.